The Clowes that I received in 2020 provides additional funding that can be used in multiple different ways, and I'd really like to highlight for me how I was able to do that. So when I started at MCW, after some really sentinel experiences during my training, we felt like the next most important space to study was related to cardiovascular health and obesity. So we wanted to try to understand if when we do a bariatric operation, beyond what we're seeing with weight loss, which we know is important for cardiovascular health, are there other gut changes such as gut hormone signaling, bile acid signaling, gut microbiome signaling that could be beneficial to how patients are getting heart healthy after bariatric surgery. Our research suggests that bariatric surgery beyond weight loss can result in cardiac function recovery. And so when I see patients who have advanced heart failure, I feel like I've been able to counsel them in a way that says, we're not necessarily just doing this surgery to get you to a heart transplant, but the data is showing us that there is a, probably 50% chance that you're going to have some meaningful cardiac recovery and maybe not need a heart transplant. The Clowes also happened during COVID. And so at our institution, we had a very unique animal colony. We have a rat genome core here at MCW and had developed a very unique knockout rat that's not available anywhere else in the country. Those colonies, which you have been breeding and building up to do experiments, had to be no more breeding could take place. You kind of had to just go back to bare bones, which probably paused our research, at least put us back 12 months. And so in particular for me, the timing of that grant allowed me to rebuild this experiment at a rate and potentially at all where I wouldn't have been able to do that again, to start over and rebuild this rat genome experiment. I'm a believer that it's critically important we maintain surgeon scientists. It is a hard walk because we're doing clinical work at the same time you're trying to advance research studies. But I believe that there's nobody who knows what the patients need more than the physician that's at their bedside, right? And so I think that the surgeon scientist asks the most relevant questions because we're taking care of the patients, and then be able to, once we're kind of studying these things, understanding how it's working, be able to quickly translate that back to the patient. That's the full circle.